is aware of, and that is something called TennCare in Tennessee. And I'm happy to yield to my colleague, freshman representative, doing a wonderful job, Dr. Phil Rowe.
Thank you, Dr. Gingrey. A couple of things just to historically to go back over. And I might mention that if the public out there that's watching this tonight thinks that the government's management of AIG is good, then they're going to be thrilled to death with the government management of health care, I can tell you that. I'm going to go through a couple little historical things. You and I went through the managed care of the 1990s and all the promises that were going to occur, the cost savings and so forth that didn't show up. And one of the things that concerned me about health care going forward is accessibility, not just in physicians, but in other health care providers, for instance, our nursing staff. By 2016, that's 7 years from now, we're going to need 1 million more registered nurses in this country. And the next 8 to 10 years, more physicians will be retiring and dying than we're producing in this country. And let me go back just a few years and read this to us right here just briefly. In its 1994 report to both Congress and the Secretary of Health and Human Services, the National Council on Graduate Medical Education noted, in managed care-dominated health care systems, the Bureau of Health Professions projects a year 2000 shortage of 35,000 generalists and a surplus of 115,000 specialist physicians, and recommended that the nation produce 25% fewer physicians annually. That was just 13 years ago. In 1995, the Pew Commission recommended medical schools by 2005 reduce the size of entering medical school classes in the U.S. by 20 to 25%, arguing further that this reduction should come from the closure of existing medical schools. Have you ever heard of anything as ridiculous as that? And think what a catastrophe that would have been had we followed this. The Institute of Medicine Committee recommended no new schools of allopathic or osteopathic medicine be opened, and that class sizes in existing schools not be increased, and that public funds not be made available to open new schools or expand class sizes. And to give you an example, just to reiterate what you've said, if physicians don't retire, and there are over 250,000 physicians over the age of 55, that's a third of the practicing doctors in America, do retire in the next 10 years, which they most certainly will. This number and the reason that that's so important for the folks listening is the access to care. What happens will be that patients won't have access to their physicians, and I've seen that. I've practiced and trained in Memphis, in inner city Memphis, and in a rural area where I am now. And of course, you all know the inner cities and rural areas are the two most underserved areas in America now. The patients in those areas are now not only having a difficult time paying for care, just finding someone to give them the care. So this particular recommendation that was made, if it had been followed, would have been an utter disaster for the American healthcare system. We need to encourage more and more young people. The community where I live has the Quillen College of Medicine, has 62 students, hasn't increased the class size in 20 years. Why? They don't have the funding to do it. And we have a tremendous shortage of primary care physicians. At the end of my practice last year, when I was still in the operating room, one of the most difficult things I had to do was find a primary care provider for a post-surgical patient. It was difficult to do now, and it's going to get much, much, much worse. I will mention a couple of things about our TennCare system. And it was a system that was started with noble objectives to provide care for all Tennesseans. And it was rapidly put together. And I heard you say at the beginning of this, we don't need to do this fast. We need to do this right. It's too important. The health care that we provide affects every citizen in this country. Every one of us is going to have to abide by this system. And who should be in control of that system are the patients and the physicians. That's who should be making these health care decisions. Now, in a survey that was done in the current budget crisis in the state was about $1 billion short before the stimulus package came along. And what the stimulus package does is simply put off these hard decisions for about 2 years in our state. But that survey showed that nearly half the physicians in the state of Tennessee would end their participation or strongly consider ending their participation in one or both of the MCOs in the state, that's the medical care organizations, if those cuts were enacted, and to ease the state budget crisis. And another 31% said they would reduce the number of TennCare patients they're seeing. That's 80% either would stop or reduce the number that they're currently seeing. And I spoke to one of our large hospital administrators this past weekend, and right now, Dr. Gingrey, we have TennCare covering 60% of hospital costs. Medicare covers about 90% of hospital costs. The uninsured obviously cover none of the costs, and the payers, the private payers, have to make up that difference to keep the hospital open. And that is you hear that your medical benefits are tax deductible and so forth. Well, I would argue they're not. If you go ahead, that's a hidden tax right there that every person who has private health insurance has to pay when they pay it. Now, I know this year because in the past year, I bought my own policy out of a health savings account. And to buy this health savings account, I was fortunate enough to be able to do that. It's about $1,000 a month. But I had to earn about $18,000 to pay that after taxes. So for a person with a health savings account or a small business or whatever that on your own, you're in real trouble in this country now. And I think a health care plan in this country should have about 4 principles. One is a basic plan, health plan for all Americans. And we can define that a lot of ways. But I think one of the ways you could define it is the least expensive government plan. And number 2, illness should not bankrupt you. If you get sick, if you develop multiple myeloma or a malignancy or something at no cause of your own, you should not be bankrupted by that illness. And number 3, it should be portable. You should be able to move. If you lose your job, as many people have done during this current recession, you should be able to carry your health benefits along and not at COBRA payments that people with expensive, who let's say Bill Gates would have a hard time paying. So I will yield back my time and look forward to continuing this discussion in the future.
Well, I thank the gentleman